Hey everyone, welcome back to the channel. Today, we're talking about something really important, HIV/AIDS. Now, I know this can be a sensitive topic, but knowledge is power, right? We're gonna break down the signs and symptoms of HIV/AIDS together, step by step, so you know what to look out for. So grab your thinking caps, maybe a comfy blanket. It's about to get educational up in here. Welcome to our channel. Today, we're diving into an important topic, the signs and symptoms of HIV/AIDS. Stay tuned to learn how to recognize these symptoms at different stages. Alright, so first up is stage 1, which happens a couple of weeks after someone gets infected with HIV. It's also called acute HIV infection, or primary or acute retroviral syndrome. Those are some fancy medical terms, right? Now, this stage is like that friend who shows up unannounced. Sometimes it's totally obvious they're there, and sometimes you don't even know they came by. Some people, they get hit with what feels like a really bad flu. We're talking fever, those chills that make you want to burrow under a mountain of blankets. Maybe a rash that's like, "Excuse me, what are you doing on my skin?" You might be sweating the bed sheets off at night, feeling completely wiped out even after sleeping for a week. And your muscles are aching like you just ran a marathon that you didn't sign up for. Some folks get a sore throat, swollen glands, those pesky mouth sores, and a headache that just won't quit. But here's the thing. And this is important, some people sail right through this stage without even a sniffle. Sneaky, right? Next up, we've got stage 2, the chronic HIV infection stage. This one's a bit of a chameleon, you see. HIV is still hanging around like that house guest who never leaves, but it's keeping a low profile. It's like, I'm just gonna chill here in the corner and multiply really slowly, no big deal. And the thing is, people can be in this stage for years, feeling totally fine. But, and this is a big but, even though there might not be a parade of symptoms, that doesn't mean everything's hunky-dory. The virus is still doing its thing, quietly weakening the immune system. Now, some folks might notice their lymph nodes are a little swollen, like they're puffing their chests out. They might pick up minor infections more easily than usual, like they're suddenly a magnet for every sniffle and sneeze going around. And some people just feel a bit blah, you know? Kind of tired all the time, like they're dragging themselves through mud. This stage, it can go on for years and years, especially if someone is getting treatment. But without it, well, the virus is going to keep doing its thing, and we don't want that. And now, for the final stage, stage 3, also known as AIDS. This is where things get serious, folks. Remember how I said HIV weakens the immune system? Well, in this stage, the immune system is like, I'm out of here. It's seriously damaged, which means the body has a really hard time fighting off infections. We're talking about infections that wouldn't normally cause a problem. But now they're like, party time! These are called opportunistic infections, and they can be really, really serious. Now, the symptoms in this stage, they can be pretty intense. We're talking about rapid weight loss, like someone hit the fast forward button, fevers that come and go like they're playing tag, and the night sweats? Forget about it. You could practically fill a swimming pool. People often feel completely exhausted, like they've been running a marathon in the desert. And then there's the diarrhea, skin rashes, mouth sores, and swollen lymph nodes. And it doesn't stop there. We can also see memory problems, confusion, and even some neurological issues. It's important to remember that AIDS is the most severe stage of HIV infection, and it's nothing to mess around with. That was a lot of information, I know. The most important thing to remember is that knowing the signs and symptoms of HIV/AIDS is crucial. Early testing and treatment can make a world of difference, folks. It can prevent the virus from progressing to AIDS and help people live longer, healthier lives. So if you learned something new today, give this video a thumbs up and share it with your friends. And don't forget to subscribe for more important health information. Remember, knowledge is power, and taking care of ourselves is always in style. Thanks for watching. If you found this video helpful, please like, share, and subscribe to our channel for more informative content. Remember, early testing and treatment for HIV can prevent progression to AIDS and improve life expectancy. Stay informed and stay healthy.